Patients have multiple options for treatment with early stage breast cancer. Traditionally, the main and only option was a mastectomy, where the breast is removed and all of the lymph nodes are removed. And over the past several years, studies have proven that doing a lumpectomy, which is only removing the tumor site, followed by radiation, gives the patient the same cure rate as having a mastectomy. We call this breast conserving therapy. The patient's allowed to keep their breast, very little scarring. We call this breast conserving therapy. A patient can keep their breast, have the same cure rate as having a mastectomy with a much higher quality of life. As far as the radiation therapy options, those have also changed as dramatically as the surgical options. Traditionally, patients underwent 6 weeks of external radiation therapy that treated the entire breast, part of the chest wall, part of the lung, and part of the axilla. And by doing this, it was a great option at the time, and the studies have proven that that gives the same cure rate as a mastectomy, but there are side effects involved. One study even shows by doing external beam therapy, it doubles the patient's risk of lymphedema. And that was very surprising to our field. So since 1991, an option for radiation therapy is called breast brachytherapy. And that's where the radiation source is put directly into the lumpectomy cavity where the tumor started and delivers radiation to a very pinpointed area right around the lumpectomy cavity. Brachytherapy is a wonderful new technology that's it's viewed as a new technology, although our field has been doing this 5-day pinpointed radiation therapy treatment since 1991. And so we have a lot of excellent clinical data showing the effectiveness of brachytherapy being equivalent to the 6-week external beam radiation therapy. Brachytherapy is a 5-day course of treatment where we put the radiation directly into the lumpectomy cavity instead of delivering the radiation therapy from the outside. So we're putting the radiation right into the source where the cancer started. So from a patient's perspective, it's more convenient. It's only 5 days. They're done with their therapy, they're on with their life. But from a clinician or from a physician standpoint, the treatment is more pinpointed. It's going directly to where the cancer started. It's exposing less of the patient to radiation, which we know is very important. You don't get the exposure to the axilla, you don't get the exposure to the lung or to the chest wall. So it's a wonderful new technology and just gives us another option to offer patients.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.